Join us every Wednesday for InFocus, a weekly talk show produced by the St. Kitts Nevis Information Service, where we provide exclusives with key persons within the government and discuss pertinent, relevant, and interesting matters that affect us all. Tune in every Wednesday, live on ZIZ Radio and streamed live on Facebook at SKNIS Media and ZIZ Online. InFocus, your government, your business.
I'm Ian Richards. Welcome to InFocus, a weekly program where we zoom in on what's happening within and throughout the government, your government. The Ministry of Health in St. Kitts and Nevis is gearing up to commemorate Vaccination Week in the Americas from April 20th to the 27th. Our program today features a discussion on the importance of vaccines, why there are so many, and the risks and rewards of being vaccinated. Our guests today are Nurse Davida Irish, Coordinator of Community-Based Nursing, Kiskisha Hazel, Deputy Coordinator Services. Stay with us as we delve into your government, your business. Thanks for staying with us, and allow me now to welcome, and pardon me, it's Davida Irish, who is the Community-Based Nursing Services Director, and also, as we mentioned earlier, Miss Nurse Kiskisha Hazel. Ladies, welcome to InFocus.
Thank you.
So we want to start with basically an explanation in terms of, for the general public, in terms of what community-based nursing services, what is it really, what does it entail?
So community nurse in practice. So we combine healthcare with nursing practices, and we are one responsible for educating the community as a large. We, in terms, educate and healthcare. We want to make sure preventative measures are put in place so they can.
So you're basically on the front lines?
Yes.
Right. And how is the interaction generally with persons?
Well, we do have a good interaction with our community. Any community event, so we do have a good relationship with the community.
Okay. And so talk to us a bit about the responsibilities and the focus of community-based nursing services. And just for ease of reference, I'll call it SKNIS, if you don't mind.
Yeah.
Community-based nursing service is basically primary health care. It focuses on preventative care, it focuses on promotion, and it focuses on the community on a whole, how to maintain a healthier life, how to live a more productive life using the strategies that are implemented. We have services such as men's health, women's health, maternal and child health services, STI clinics, antenatal services.
And STI, just stop it.
Sexually transmitted infection,
right.
Yes. Sexually transmitted infection, including HIV screening and counseling. So these are some of the services that are offered within the community-based nursing services. Primary health care, preventative care, and promoting health.
And so generally one would say that there is a clear difference between the nurses, or the role that nurses performs, whether it be at hospitals, at clinics. Would you talk to us a bit about that?
So basically the nurses at hospital, the role is partially different, because hospital is more engaged in secondary care, whereas in health center we deal with primary care, as Hazel just outlined. So we prevent them from going to the hospital. That's our main focus. Whereas hospital is basically trying to get them back to health, to bring them back out to the community. So we are prevention, where they are basically getting people back to a sense of wellness.
So it goes to that old adage, prevention is better than an ounce of cure.
Yes.
Right. Okay. And the message of prevention, is that really embraced by persons who you engage with? Is there pushback from them in terms of, well, it's my body, I can do what I want with it? Generally.
Generally, we get that a few times. Our diabetics, our hypertensive, you know, they are, those that attend the health center, they are more up in age. And so it's difficult to get them, when you try to educate them on the right diet, it's difficult to get them to eat properly. They usually say, I've been doing this for so many years. So fight backs normally be there with the more elderly person in community.
And so what strategies are engaged to try to push back against that and to help to better inform them to make better decisions?
Some strategies that we normally encourage is to have the family members engaged, especially children, because you know children tend to carry the message forward. And if you educate children and family members about these various conditions, they tend to say, if they see grandma or grandpa doing something that they're not supposed to do, you know, they tend to say, you know, remember the nurse said don't do that, or remember the nurse said you're not supposed to eat this, or something of that sort. So we try to go that route where we involve family members into health promotion strategies and care of persons, you know, the elderly generally. That's one of the main areas, and we tend to encourage them and continue to educate, because you know, sometimes you may hear something once, and it's by hearing it about several other times that it really sticks to you. So we try to continue our educational strategies and involve the wider community on a whole.
So mention was made earlier of the type of agencies or community-based groups that you engage with, and of course, I suppose that is why it's called community-based, you know, yes, the type of engagement that takes place. So tell us a bit about how it relates to the institutions now, and also with how it differ with the health, the Ministry of Health aspect of it, where of course there is health institutions as well.
Well, basically we engage all the general public institutions, and we encourage them to come to us or seek us out. And remember, it's also primary healthcare service, preventative service, health promotion services. So we offer our services in instances of outreach. So we are engaged a lot with outreach activities. We encourage the businesses to, you know, seek out our services, and we also go into those businesses to try and be a part of the activities they may, you know, celebrations. There's various types of celebrations that they would have, and we try and get ourselves involved so that we can assist those persons to live a healthy and longer life.
So what does that look like? Because I know there are a number of companies who would have celebrated an anniversary, and I mean, just stick with the cable then. The cable, of course, would have celebrated 40 years. They're as old as a nation in terms of the years that they've been in operation. So is there an opportunity then for SKNIS to basically link with the management of the cable and say, okay, you are celebrating it, we have services that may be beneficial for your employees? Is that how it works?
Generally, there is a health promotion form that is to be filled out from the Ministry of Health aspect. There's a health promotion unit, so that form is usually filled out. And so they would say the type of services that they would need, whether they would need HIV testing, they would need blood pressure testing, or whatever type of service they would need, nutritional counseling, and then we would provide the staff based on what services they may require at that time.
Is there any suggestions that comes from the ministry, from SKNIS, in terms of maybe you want to considering that maybe you have a higher male population in terms of employees?
It depends on what's going on, and it depends on, generally it depends on what's going on around, because there are different types of celebration. such as, you know, you have things like World Hygiene Day or World Tuberculosis Day or all that different. So it just depends. We usually tag it to some things. It's usually tagged to something, some sort of disease or some celebration. So it's usually tagged to that, and then it depends on the area. Some persons might have an outreach whereby they want to reach a wider or female population, so they want to have cervical cancer screening, pap smears. So it just depends on what they require, and it depends on what is going on within that space or time frame.
Okay, so let's talk a bit now about vaccines and the relationship, or should I say, vaccines, the relationship that people have to vaccines, in the sense that, you know, there are some persons who are afraid to take a shot. I remember, especially with young children, you know, it's painful, it's going to hurt for a couple of times, and so there are a lot of persons who may not want to take a shot because they're afraid. Talk to us about the importance of vaccines, first of all.
Because we have a few diseases out there, that's why vaccine was invented in the first place. So we encourage people to take vaccine so we can decrease. At present, we don't have an outbreak of nothing in St. Kitts, and we want to keep it that way. So we encourage people to take the vaccine to prevent these diseases from reoccurring in our society. So if someone come and they're afraid, of course we counsel, we encourage the parent when they bring the child to give the child a pep talk before they actually come to the health center, just to get them aware and know that they're going to take an injection. We usually say it's just a little prick, like when an ant sting you, ain't nothing hard, just try and relax. So we try to encourage the parents to actually do their part before actually bringing the child and just abruptly saying you're going to take an injection. So we want the child to alleviate some fear prior to coming to the health center. But when they reach, we do try our best. We speak to them, we counsel them, we do try to get them like in the in a safe mode, basically, so they feel comfortable taking the vaccine.
Hazel?
Add that it's important for parents to prepare their children for vaccines, because I know in the past, and I hope it's not happening now, persons used to threaten children. Oh, I'm going to take you down to the nurse so she can give you an injection in your mouth, or, you know, that kind of stuff. And I think this is one of the reasons why some children are very fearful of injection, not just vaccine, but injection on a whole. And just to encourage parents to, you know, speak to the children, you know, help them to understand that it's not something to be fearful about. It's something, it's a part of life. This is something that's a part of life, because, as I said, injection on a whole, not just vaccination. And now and again, persons might have to receive an injection for whatever reason. So it's important for parents to, you know, do their part when it comes to vaccinations.
How do vaccines work?
Vaccines contain a weakened or an inactive version of whatever virus it's protecting you against. As I said, some are weakened, some are inactive, thereby helping you as an individual to develop antibodies to protect you against the disease or the condition. So it's almost like a blueprint. So you receive the vaccines, your body make these antibodies, and if you ever to come across these viruses or bacteria in the future, then your body will be able to recognize and protect you against that. And that's how vaccines generally work.
So then a big question that persons may ask is, why are there so many vaccines?
Because there are so many diseases. And we want to prevent the diseases from spreading, and most of these diseases, the end game is life-threatening. Mm-hmm. So vaccine was invented to prevent these diseases and to save lives.
Okay. And % efficient,
I cannot speak for years gone by, but if you ask your grandparents, for example, for measles, how much measles breakout they had back then in St. Kitts, how many persons died from measles, they can tell you. In our generation, we never see a live measles case in St. Kitts. We see it on the television. So we know vaccine works. We know to a fact it works because we don't have these diseases right now in our area. So we know they do work.
Do they the different vaccines in terms of the time span, in terms of when you get a shot, years later, do you have to take another shot, or is it something that would last for a lifetime? And a bit about that aspect of it.
Okay, we have several vaccines that are given in St. Kitts, and each one of them have a different span.
And of course, that will be St. Kitts and Nevis.
St. Kitts and Nevis. Sorry. So, for example, we get a BCG at birth that cover you for a lifetime.
What's BCG?
We get Bacilli Gonorrhea colitis. So we get that, and that cover you for birth. We get MMR 1 and 2, measles, mumps and rubella, that cover you for lifetime. We get vaccine like tetanus. We know we get at least 6 tetanus between 0 to school leaving age. So at the end of the 10 years, at the end of the school leaving age, we have what we call a booster, because every 10 years for that, we have to get a booster. Except for persons that do high-risk jobs, like person that deal with like funeral homes that deal with the dead, they have to get that every 5 years. Person that deal with construction, every 5 years. Otherwise than that, every 10 years for the average person. Why
is that? Why does it have to be a lot sooner for those who do high-risk jobs, as you term them?
Because they deal with fluids, and for those that deal with the dead, and you have those that deal with sharp metal, the construction worker that deal with metal or rusty nails. They are at higher risk of getting a nail prick to that effect. So,
is it possible if you are vaccinated against something that it comes back, or that you can still catch it?
No, because your body already built up immunity to it. So when you get that disease, they already see it as a norm, so nothing would happen to you.
So it's essentially, Nurse Hazel, and you can jump in here, in terms of identifying your immune system, the body, to be on the lookout. I would compare it to a police officer, a BOGO. Be on the lookout for where, if you see this sign, the body knows, okay, this is a threat, I need to neutralize it. That's basically how vaccines work.
Generally, yes. Yes.
Okay. So what we're going to do, ladies, is that we're going to take a quick break. We're about that time, and then we'll continue our conversation, because one of the questions that persons would ask in terms of this vaccination rate in St. Kitts and Nevis, what does that look like? So before we tackle that question, we're going to take a quick break. Stay with us. We'll be right back with more In Focus.
If you haven't done it as yet, please do it today. Subscribe to our YouTube page at SKNIS Media for regular updates, live coverage, and even more information on your government. While you're at it, like, share, and interact with our Facebook and Instagram pages at SKNIS Media and SKNIS Info.
Welcome back to In Focus, and we'll continue our discussions on vaccination as St. Kitts and Nevis gears up for Vaccination Week in the Americas. That will be on April 20th to the 27th. And we are speaking to Nurse Irish and Nurse Hazel, who are from the community-based services. So ladies, before we left, we spoke about vaccinations and the importance of them. So then the question that persons would ask is, what is the vaccination rate for St. Kitts and Nevis?
It's difficult to give you the exact vaccination rate for St. Kitts and Nevis, Since we started the vaccine program, we have always tried to reach the population of the 0 to the 5-year-old at 95% and above. But we have to be mindful that we have people coming into the country and we don't know their vaccine status. So if it's at this point, it's difficult to give you that data.
Shouldn't that be a requirement, one may argue, in terms of you coming into the country, that you should declare your vaccine status? Is that a best practice?
Yes, it is a best practice.
Okay. Do you know, in terms of the difficult, you said that it's difficult to assess the vaccination rate. So then you probably wouldn't be able to give a sense in terms of where we stand in terms of the region, in terms of other Caribbean, OACS or CARICOM countries.
We stand high compared to other regions, but we know about the 0, as I said, the 0 to 5. That we always have a 95% coverage, but beyond that, it's difficult to say adult at this stage.
Is there a segment of the population that are against vaccines?
We don't want to say there's a segment, because in each community, you would have a few that refuse to take the vaccine. So we don't want to say we have a segment of the population. We do have people that refuse the vaccine for religious reason, cultural reason, they just don't want to take the vaccine. But in terms of segment, no, we don't.
And how do their decisions impact the wider community?
Well, generally they are putting themselves at risk, and they are also putting the community on a whole at risk, because just in case a case of measles comes into country and come into contact with that individual who is not vaccinated or is not up to date with their vaccines, of course that will be you know, a big spread there, because MMR measles is very, very contagious. So you don't want persons to think that, okay, I'm not going to get vaccinated because, you know, I choose not to, and then you as that individual putting others or putting the society at risk because of your choice.
And of course, if you are ill, it affects the productivity of the country.
Exactly.
And so then the question would be then, how does the SKNIS tackle these issues of persons who may opt not to take a vaccine? What strategies employed?
Generally, we continue to encourage them. Okay, the main focus is to continue to encourage them. We cannot force ourselves on them. We cannot force them to take something that they don't want to take. But we continue to encourage them to take the vaccines, and we continue that strategy.
Now, we mentioned in 0 to 5 that is the population that is largely targeted, and of course that will cover children, the very young amongst us. Why is it important for them to be vaccinated now, especially at an age where they're a couple months as a baby?
It's important because the vaccines generally work best for children. It generally works best the younger you give the vaccine. And also there are persons who are generally at risk because their immune system have not developed to that effect. So generally they are at risk, and also persons, you know, in the elderly population. So there are two areas there that's at risk. So we try and make sure that our young population is vaccinated, as well as persons who in the elderly community, because they're at risk generally for developing diseases or contracting diseases.
And of course there are efforts to mobilize school children sometimes to go to clinic and get shots for those who, you know, may not have had them. Tell us a bit about the relationship between SKNIS and the Ministry of Education and how that works essentially.
Okay, we have, you can say Ministry of Education is our biggest stakeholder. We normally would send a letter to the Ministry of Education. Anything we're having, we send a letter to the Ministry of Education, and they always respond well to us. So we'll send a letter and ask, for example, if we are seeing the children on the 30th, we ask for that date. If they cannot accompany us on that date, then they would give us a date. But they always work with us. And even if we are promoting vaccine at PTAs, they would send us the schedule of all the PTAs, public and private schools. And so we fit in ourselves to go to these PTAs and educate the parents. So they always work with us.
Okay. And what does that conversation look like with the PTAs? Because, of course, St. Kitts and Nevis, we have as you would establish earlier, generally high rate of vaccination. And so is there difficulty in terms of engaging the parents and getting them convinced that, yes, you should get your child or your children vaccinated?
We do have a little difficulty here and there with, between various schools, but nothing major to speak about, because, you're going to have those pockets of persons who are kind of skeptical and who may not want their children to be vaccinated. But generally, in the end, those are the same persons who show up, and they show up first too, even though they are giving trouble during PTA, asking a lot of questions. And of course, we encourage you to ask questions, but so generally we do not have a major hiccup as it pertains to dialoguing with the parents in PTA meetings.
So the strategy essentially it works, that the message gets across to the parents, and they actually, as you mentioned, they are first in line to get their children to take a vaccine or an injection, as you would say. Okay, so they talked to us now a bit, ladies, about, as we mentioned, persons coming into St. Kitts and Nevis. What about persons going out of St. Kitts and Nevis? Is it important for them to get vaccines, any type of particular vaccines?
It's important for a person going out if they're going to a country that is having experience in a breakout, is known to have certain type of diseases. So if someone is going to countries, for example, yellow fever, because yellow fever is not a routine vaccine that we give. We only give persons who's going to country that they have the yellow fever virus. So it depends on what country they are going. Yes, we offer that yellow fever vaccine. And we advise person, for example, right now, we know there's a breakout of measles in countries that we know our citizens are visiting regularly, like England, USA, Canada. So we advise right now is to make sure they're up to date with the MMR. Make sure they had 2 MMR vaccine before traveling, so they wouldn't be at no risk of getting the MMR, the measles virus.
And if someone who is traveling to an area where there is an outbreak who opts not to take a vaccine, tell us a bit about the dangers of that and what is the impact for the community here in St. Kitts and Nevis.
The dangers is one outbreak is like an endemic, an epidemic, because measles especially is very much contagious. And if they, contract the measles virus, it's highly likely that they're going to infect a wide variety or a wide range of individuals due to it being very contagious. So they're exposing themselves as well as their immediate surroundings and their communities.
You mentioned that there are currently no outbreaks here in St. Kitts and Nevis. So the question would be asked then, should persons be up to date with their vaccines when traveling to St. Kitts and Nevis?
Yes, both traveling in and traveling out, you should be updated with all your vaccines. It's important, because you don't know what you would end up on out there, generally. Either way.
Sarah, anything you wanted to add?
Basically the same thing. We have to make sure we protect our borders. So, yes, person coming in should be vaccinated coming in.
And when you get a vaccine, you are issued a vaccination. You have a vaccination record where you can keep a track of the type of vaccines that you would have received, when it was done, that type of information that would be important, especially, as you mentioned, if you're traveling out of country. So what happens if someone may have misplaced their card? What takes place then? And they are traveling to an area.
If somebody misplaced their card, then they first need to go to the health center where they would have received their vaccine, especially their basic vaccine, childhood vaccines, because that health center would have their record, of course, and they would, dialogue with the nurse in charge there, and then she would, pull as long as the information is available, because, sometimes due to different reasons, flooding, fire, whatever reason, some documents may be damaged, and if the information is there, of course, she'll be able to document that on a card for them that they'll be able to take with them when they are going. However, if the information is not there and there has been a time has passed, and they may need a booster dose of the vaccine, then she can give them that booster dose and record the vaccines on a card for the client to take with.
Are there any risks from taking a booster shot or getting vaccinated again with the same vaccine?
No, there is not any risk, because some vaccines are actually given in doses. They require multiple doses, whether 2 dose or 3 dose or 4 dose. So generally there are no risks, no known risks to talk about that was, reported.
Okay.
And a booster shot is really the same vaccine you're getting, but it's just called a booster.
So there are no side effects, no ill impact that would have been recorded here in St. Kitts and Nevis to persons who may have received such?
No.
No.
Okay. All right. So in terms of the conversation that we're having in terms of vaccines, what type of vaccines now would you say that persons in St. Kitts and Nevis, as you mentioned, from 0 to 5, you mentioned some of them already, but going forward as we continue to age and grow, that is required here in St. Kitts and Nevis?
So at 18 months, so we did speak about the BCG and we did speak about MMR. So we have what you call a pentavalent, that's 5 vaccine in one. So you get that at 2, 4, 6 months. And then at 1 year you get the MMR. 18 months you get another MMR and a booster shot of the penta DPT, what you had at 2, 4, and 6 months. And then at 4.5 you get another booster vaccine. That's what you already had. So that would make 5 doses of DPT you will be receiving. And then we introduced in 2018 we introduced the HPV vaccine. The reason for this, because a study was actually conducted, and we have the HPV virus 6 and 8 and 16 and 18, 6 and 11, sorry, 16 and 18. So that's why we decided to introduce the HPV, and that is given to grade 6 student. No age group, just grade 6 student. And then after school leaving now, after 5th form, when you're in 5th form, then you get a DT vaccine and a polio mouth jab. So that in our vaccine schedule, unless you become an adult and we find out that you didn't have this vaccine, then we have to give you as adults.
And we want to talk a bit more about the HPV. As you mentioned, it is something new that was added, and HPV stands for human papillomavirus.
Yes.
Yes, so we want to talk a bit more about that, and also MMR, because of course, as you mentioned, there's been a return of measles on the regional scene and also on the international scene as well too, and so that is something that persons would have to be mindful of when they travel. But before we get into that discussion, we're going to take our final break. Stay with us, we'll be back with more In Focus.
If you haven't done it as yet, please do it today. Subscribe to our YouTube page at SKNIS Media for regular updates, live coverage, and even more information on your government. While you're at it, like, share, and interact with our Facebook and Instagram pages at SKNIS Media and SKNIS Info.
Welcome back to In Focus. We continue our discussion on vaccines, and we are moving into the discussion on measles, mumps, and rubella here in St. Kitts and Nevis, and the importance of vaccines. Since we don't have any cases of that, the importance of keeping it out. We're speaking to from the community-based services, Nurse Irish and Nurse Hazel. So let's talk a bit about the MMR as we call it now, and what that looks like, because there are many persons who may have forgotten in terms of measles, forgotten in terms of mumps, what these looks like. Talk to us a bit about that.
Well, as Nurse Irish indicated, in our, we haven't seen the measles, mumps and rubella for some time now. That's not something that we are privy to because of the implementation of vaccines in the past. So we were not exposed to measles, mumps and rubella. This is something that you would hear outbreaks in other countries, because our coverage rate for measles, mumps and rubella have been one of 95% and above for us here in the Federation. So it's not something that we have been exposed to, but we continue to encourage persons to ensure that they have their 2 doses of the vaccine in order to be covered. So you must have 2 doses in order to be covered of the measles, mumps and rubella to be covered. In the past, they were giving just measles and just rubella by themselves. However, they have combined the 3, so it's now measles, mumps and rubella. So persons who would have had maybe just measles back in the past, they are also encouraged to get at least 1 dose of the measles, the MMR now here.
It's measles, there are bumps on your skin. Talk to us a bit about what the symptoms look like.
So there are a generalized rash about the body that the persons may have. Of course, fever would accompany, because fever and pains and aches are generally what accompanies most conditions. But the main thing is the generalized rash about the body. So that's the main indicator there. And you must at least have fever with that as well. But as I indicated, it's not something that, we have actually, because you can have rashes with other conditions, so it's important to outline whether it's measles or not as well. So you must have a blood test to confirm the condition itself.
So the advice is, if you see rashes on your skin, that you should visit your doctor, visit a community center. What's
just to confirm, yes, just to confirm. Yes, of course.
And how is measles and the others contracted?
It's very much contagious, whereby if you're in close proximity to the individual, of course, you would be able to get the virus.
And
just let me add, if the person, it also causes infection of their throat and infection of the ears. So it is spread by, if somebody cough or sneeze in a room, the particles actually stays in there for up to 2 hours. So 2 hours after you walk in the room, you can still actually contract measles, even though the person already leave the room.
Is it the same scenario for mumps and rubella? Or are they varying diseases?
Basically the same.
Okay. And what about HPV? What does that look like?
In the
symptoms of HPV.
Oh, the human papilloma
virus.
Okay. The HPV, you don't really see. You would have to do a pap smear to detect HPV. HPV is mostly found in the soft tissues of the body, which would be the mouth, the anus, the vagina, and the vulva. So mostly a pap smear for female. When you do a cervical pap smear, that's when you will detect the HPV.
So SKNIS, ladies, it's gearing up for the vaccination week, as we mentioned. It's April 20th to the 27th, so it's fast approaching. Tell us a bit about some of the activities that are being planned to address this issue, to let the public know, to get them sensitized to the importance of vaccination awareness.
So the week begin on the 20th. We always have the Prime Minister, the sitting Prime Minister, do his speech. So he will give a speech on the 20th.
It's always the Prime Minister, not the Minister of Health?
It's the Minister of Health.
Okay.
Because
This Prime Minister is the Minister of Health. Yes, right. Okay.
It's the Minister of Health who normally give the remark and to open the week of activities. So, and speak to the country about the importance of vaccine, as we know. So the Monday, we are looking at being in high traffic areas, like on 4th Street, in business places. We already wrote to some business places, just awaiting the answers, because we just want to be in there, just to educate people as they come in to do their business, just to make them aware, like, yes, this virus is out there, like it's just a plane flight, it's just a flight away from entering our island. We want to make sure that you know that the importance of vaccinating your children. So that would be happening Monday, Tuesday, Wednesday. Also the whole week, you can just walk into any health center and ask about your vaccine status. If you have your card, you walk with it, and just to make sure you're up to date with all your vaccine. If not, we'll give you the vaccine. Also in the afternoons, we'll be going to schools to conduct PTA meetings to speak about our HPV. What we didn't say that when we started the HPV in 2018, we had a rate of 92%. At present, our HPV have gone down to 67%. So we want to make parents more aware that, yes, the children are getting it now, but we are looking at long-term effect, like 20 years from now, when they are 32, they can also always contract the HPV bacteria, which can cause cancer, which can cause cancer in different places, as I mentioned before. So the purpose is to get them aware now, because you may say my child is young now, but 20 years from now your child is an adult and they're in the world. So that's why we want to make them aware, because there does be some they complain that, oh, they need it now, they're not going to get this, they're not going to get that. So for the whole week, we going into schools at PTA meetings. Thursdays and Fridays, we normally collaborate with Ministry of Agriculture for the fair, and we normally go to the fair. So that's what we'll do this year.
Okay. And the theme, is there a theme for this vaccination week?
Yes.
Yes, its theme is Engage Now, and Engage Now to protect your future. Sorry.
Which basically is the message that is being communicated, the importance of engaging now. All right. And in terms of some of the activities now, you mentioned that you've been reaching out to companies, etc. How has that been? How's the feedback been like? Are they excited?
I haven't received any feedback as yet.
So here is your
them till next week.
Here's your opportunity to appeal to them. Ms. Hazel, maybe you want to help?
We're just encouraging the general public, especially the business places, to welcome us and help us to spread the word, to engage and to protect the future.
Right. And your message, that was a message to the public. What about the message to the companies now? What about your message to the public overall about the importance of this week and the importance of vaccines and vaccinations?
We want to encourage all parents, and we just want to let you know vaccines are important. Vaccines save lives. We want you to bring out your child, your children, if you have more than one, to get the vaccine. We want our vaccine uptake to reach back to at 95 and above. We want to make sure that our society are covered with vaccine. Our children live healthy lives. We may not be privy to some of the childhood illnesses because we are covered with vaccine. So we're not really seeing the seriousness of it. But until then, we want to keep the community safe. We want to keep everyone safe. So we encourage you to vaccinate your children, if you have more than one.
And you mentioned that you engage with schools, you engage with churches, you engage with different institutions. If there's someone who would like to engage your services to have a professional come in and do any sessions, how can they do so?
They can just reach out to any health center and request any session that they want.
Okay.
The nurses are more than willing and able to come and give talks to any events.
Right. So, Nurse Irish and Nurse Hazel, we'd like to thank you so much for joining us on this edition of InFocus and raising the public awareness. And of course, as we mentioned, it's the end of next month, so we'll be sure to keep our ears and our eyes peeled in terms of seeing you and other persons from the Ministry of Health out there promoting, and we pledge to do our part. You know, I encourage you to speak more to the media persons. You know, there are persons who are out there listening on social media. Imagine that may be a part of the strategy that you have with the health promotion unit.
Yes.
Right, and so we would like to see a lot more and you know, really get the public sensitized to the importance of vaccines and vaccination. So thank you, nurses, for joining us for this edition of InFocus.
Thank you for having us.
And we'd like to thank you, viewers and listeners, for joining us for this edition. We trust that you will join us next week at the same place, at the same time. For now, I'm Ian Richards.
Join us every Wednesday for InFocus, a weekly talk show produced by the St. Kitts Nevis Information Service, where we provide exclusives with key persons within the government and discuss pertinent, relevant, and interesting matters that affect us all. Tune in every Wednesday, live on ZIZ Radio and streamed live on Facebook at SKNIS Media and ZIZ Online. InFocus, your government, your business.